I'm here today to talk to you about postpartum hemorrhage. I want you to follow along on your pamphlet that I gave you. And we're going to discuss what is it, how this could happen to you, how to know if too much blood is occurring, because you will have something called lochia or discharge after pregnancy for quite a few weeks, but you need to be sure that it isn't too much. We're going to go over some of the risk factors, your signs and symptoms, and how we treat it. So, postpartum hemorrhage is defined as an obstetrical emergency where you have an excessive amount of blood loss. That is 500 milliliters, which is this much, one water bottle, after a vaginal birth, and 1,000 milliliters, so that's 2 of these, after a cesarean section. Postpartum hemorrhage can occur because the placenta attaches to the wall of the uterus and is what provides food and oxygen during the pregnancy to the baby. But when your baby is born, the uterus continues to contract and deliver the placenta. These contractions help compress the blood vessels and stop bleeding from where the placenta was attached in the uterine wall. But sometimes these contractions are not strong enough and bleeding still occurs. Also, parts of the placenta can stay attached and the whole placenta is not delivered during birth. Typically these happen within 30 to 60 minutes after birth if it is going to happen, or within the first 24-hour period. So usually women in the US would be at the hospital. Sometimes this happens after the 24-hour mark and up to 6 to 12 weeks. It's really important that we go over the signs and symptoms so you know what to be aware of and let us know if you're having any complications at all. Like I said, the primary postpartum hemorrhage would occur within the first 24 hours, and secondary postpartum hemorrhage is after 24 hours up to 6 to 12 weeks. So this could happen to anyone who's given birth. Sometimes there's no risk factors associated, and that's in about 40% of cases. In about 80% of cases, the main cause is uterine atony, which means lack of uterine tone. Like I said, there is not enough force of contractions to stop ongoing bleeding. Another factor would be the trauma to the tissue. So excessive trauma due to birth or episiotomy or some other things that surgical tools were needed during the course of delivery, and there is trauma to the tissue. Placental tissue being retained in the uterus also is another factor in postpartum hemorrhage, and as well as thrombin or clotting disorders. So if you have a blood clotting disorder, it's always important to mention that to the provider from the beginning, because maintaining and prenatal care is very important. But also sometimes women can develop a clotting disorder during pregnancy, and we need to make sure we address that. Some of the things we're going to have you monitor is the amount of discharge. So when you have a pad on, like in the pamphlet, right, especially within an hour, if you go through more than one full pad in an hour, you need to let somebody know. If you're going through multiple pads within a few hours, you need to let somebody know. Sometimes some other symptoms would be blurry vision, feeling dizzy, having a lot of lower abdominal pain, and you just want to make sure that if you're having any clotting or passing of clots, especially larger ones like the size of a golf ball, that you have to call someone right away and don't wait, go right to the hospital. If your skin is cool and clammy, so you just can't seem to, it's humid, when it's very humid and your skin feels tacky and wet, call us right away. Some risk factors that make people more prone to having postpartum hemorrhage is obesity, multiple pregnancies, having had a previous postpartum hemorrhage, prolonged labor or very rapid labor, an episiotomy, lacerations, or coagulation disorders. Our treatment options are fundal massage, immediately starting IVs because we don't want you to become hypovolemic, which means excessively dehydrated, because everybody needs to have a balance. Sometimes we may have to do a hysterectomy. That would be a very radical option. But we do use uteronic medications like oxytocin, and sometimes we use something called a uterine balloon. And on occasion we need to insert a catheter because after procedures sometimes it's really hard to potty, and that's pushing on the uterus and causing issue. So there are a lot of things that we need to evaluate, and which is why we ask that you come in right away if you notice anything. Even if you aren't sure that it may be an issue, we want you to come in. It's not a problem. We'd rather check and make sure that everything is good, and if something needs to be done, that we can help get you back on track to recovery. So like I said, we always want you to call your provider and double check. And some of our treatment options after and for management at home are going to be iron supplementation, maintaining your diet, and having a supportive environment where you can really get rest and focus on the baby and yourself. So just to recap, this could happen to anybody. It's not necessarily anything that could be prevented, but some of the things that will help will be making sure to monitor symptoms. If you do have a change in feeling dizzy or lightheaded, change in your vision, have a headache, lower abdominal pain, excessive bleeding, we want you to come in right away. I hope this gave you a lot of information to make sure that you're looking out for, and I look forward to talking to you again. Thank you.